Before we start with our discussion, let us first give the meaning of family planning. Family planning, as defined by the World Health Organization, is the ability of individuals and couples to control the number, spacing, and timing of their children, mainly through contraception and infertility treatment. It includes services like contraception, sex education, STI management, and preconception counseling. Family planning empowers informed reproductive choices, leading to better health, social, and economic outcomes. According to the Merriam-Webster, it is intended to determine the number of one's offspring by using effective methods of birth control. In the Philippines, family planning is a key public health and human rights issue supported by laws like the Responsible Parenthood and Reproductive Health Act of 2012 and the Universal Health Care Act of 2019. This ensures access to reproductive health services for all, regardless of background. Despite progress, over 10 million Filipino women still lack access to family planning, with only about 58% of demand currently met by modern methods, short of the 75% FP 2030 target. Efforts by the Department of Health, UNFPA, and FPOP focus on making services voluntary, affordable, and accessible, integrating them with broader health programs, and these initiatives align with global goals recognizing family planning as a fundamental right crucial to gender equality and poverty reduction.
Family planning is not just a health measure, it's a life-changing choice. It empowers women to take control of their futures, carefully planning and spacing their pregnancies to protect their health and the health of their babies. This is a simple yet powerful decision, reduces medical risks, and saves lives. But it doesn't stop there. Family planning puts the power of informed choice in the hands of individuals, helping prevent unplanned pregnancies and reduce the spread of sexually transmitted diseases through effective contraceptive use. And let's not forget the financial side. When families can plan based on their income and lifestyle, they create a stable, secure foundation for their children's future. So let's be clear. Investing in family planning means investing in stronger families and a brighter, more secure future for all.
Why is family planning important? Family planning is important because it helps individuals and families make informed decisions about when and how many children to have, leading to better health outcomes, financial stability, and improved education opportunities. It reduces the risk of health complications for mothers and babies, empowers women to pursue education and careers, and helps families provide better care and resources for their children. By managing population growth, it also eases pressure on resources, promotes sustainable development, and can reduce poverty. Ultimately, family planning ensures healthier, more balanced lives for both individuals and communities. Here's a brief introduction to family planning methods. Family planning methods are broadly categorized into modern and traditional methods. Modern methods include hormonal contraceptives such as oral pills, injectables, and implants. Intrauterine devices or IUDs, barrier methods such as condoms, sterilization for male and female, patches, vaginal rings, and lactational amenorrhea method. For the traditional or natural family planning methods, it involves tracking fertility signals such as the rhythm method or the calendar-based, the cervical mucus observation, the basal body temperature monitoring, and lastly, the simple thermal methods that combine several indicators. Each method varies in effectiveness, convenience, side effects, and protection against sexually transmitted infections or STIs. For example, condoms uniquely provide dual protection against pregnancy and STIs, while hormonal methods do not protect against infections.
The Philippines, there have been laws that have been passed about family planning. The first one is the Responsible Parenthood and Reproductive Health Act of 2012, which are also known as the Republic Act number 10354. It is a law is it is a law that enhances access to reproductive health services, which includes family planning. Second is the Universal Health Care Act of 2019, also known as the Republic Act number of 11223. This complements family planning by expanding the healthcare coverage and integrating family planning services into universal healthcare. And the third one is the Magna Carta of Women, RA 9710, which gives women more guaranteed right or more guaranteed access to comprehensive health services, including family planning, and it mandates gender responsive healthcare and protects women from discrimination in accessing reproductive services.
The challenges and goals in the Philippines in the context of family planning. For the challenges, unmet need for family planning remains, especially among sexually active unmarried women in the certain regions like BARM. The government targets zero unmet need for modern family planning through strict implementation of laws and expanded service delivery. The Philippine Family Planning Handbook of 2023 provides updated guidance for providers incorporating the latest World Health Organization recommendations and addressing service delivery under universal health care and emergencies like the COVID-19 pandemic. In summary, family planning encompasses a variety of contraceptive methods that empower individuals to control fertility. In the Philippines, supportive laws, health programs, and service integration have expanded access and use of family planning, contributing to declining fertility rates and improved reproductive health outcomes. However, ongoing efforts are needed to address unmet needs and ensure universal access to quality family planning services. The Church and Family Planning. For the general position of the Church, the Catholic Church does not oppose the idea of family planning itself. It encourages responsible parenthood, meaning that couples should prayerfully and thoughtfully discern the number and spacing of their children, considering both their circumstances and God's will. The Church emphasizes that marriage is a sacred union, open to the gift of life, and that parents are privileged cooperators with God in the creation and nurturing of children. For the artificial contraception, the Church explicitly rejects all forms of artificial contraceptions, including condoms, birth control pills, sterilization, and other methods that intentionally render procreation impossible. The rationale is rooted in the belief that every act of marital intercourse must remain open to the transmission of life, preserving the inseparable connection between the unitive or the love giving and procreative, which is the life giving, aspects of sex. Artificial contraception is seen as interfering with this natural order and the dignity of human sexuality.